is everybody new to home care? Families are new to home care, not necessarily in the business of home care, but new to the idea of having help in the home for the families. Yes. Anybody currently have help from us now? Because I think there was a couple of you. Okay. You're coming on to service December 1st?
Yes.
Okay, so this is brand new. Okay, so this is why we're starting this monthly conversation with families, because what we find is when people come onto service, their expectations is one thing and the reality is something completely different. So we like to have our families come, get to know us. Julia, there's other coordinators that are not here right now because I can't expect everybody to stay after hours, but Julia was kind enough to stay. So she's going to talk a little bit about the coordinating piece of the services that your families are going to be receiving and what the coordinator does in a licensed agency. Other than the fact that I'm the nurse here, coordinator and social worker, but she's going to talk a little bit about coordinating.
Hi, everybody. Welcome for those of you who are new, and it's nice to meet some of you that, we've never met in person, right? Probably maybe spoke on the phone. So a lot of what happens is that, initially I will call you guys, find out some details of the member, the patient, find out some of the needs that you guys are expecting to have, and then we help fulfill that. Like any relationship that you have in your life, sometimes it's touch and go. So, the first aid that walks through your door, not everybody's going to click the first time, right? So that's a conversation that you'll have with me to say, can we try somebody else? And I'm going to ask why. So, and it's important to share those details because that'll help for me to cover your case moving forward, correct? What I would like to do is for, to have somebody that's going to go to the home, it's for companionship also, so that you can help talking, but there's also care that the patient needs, showering, some is food, some is errands, some is doctor's appointments, accompaniment, some are running errands, going to the pharmacy and picking up things of that nature. So there's some things that the home health aide won't do, laundry for other people in the home, they're not or will not be doing. It's specifically for the patient itself. So her laundry, his common area, her common area. If they live in a home with other family members, then that really applies to their bedroom and their sitting area where they're at the time. Kitchen or cook a proper meal is their responsibility to clean up. If the family had dinner the night before, it's the responsibility of the family members to make sure the kitchen is clean and left so for the aide when she comes in the next day. Laundry, she will do that if there's a machine in the house, of course. If the laundry has to be taken out, of course she can go do it at a laundry service, but expectations have to be reasonable. If she can walk a block to do it, no problem. If it's a half a mile away from the house, she would need to be provided with care, transportation to get there. The other thing is that sometimes where we live on the island is not necessarily always local to public transportation. And for some, it could be a 20-minute walk from a bus stop. So in those instances, not everybody has a car, right? So those people will walk. But a car is not a prerequisite for the job. So we just have to understand that not everybody will have a vehicle to provide, to do the laundromat that's a half a mile away.
So as far as coordinating goes, everybody has a schedule set up for their families, so that's authorized through whoever the managed care is. Julia will put them into the calendar and then assign the aide appropriate for the hours, to the location, and what the family's looking for. Every single family has the same wants and needs. I'm sure if you all talk to each other, everybody's going to say that they want someone that speaks perfect English, someone that can cook for their parents, someone that can take care of all the levels, and that's just not always reality. They are coming with some language issues a lot of the times. They are not going to speak like me. They are not going to speak like Julia. They do have accents. One of the things, if you guys have read, I don't know if they handed this out, but these are the things that we do here as a company that sets us a little bit apart from other businesses. One of them is in January, because we do recognize that there are issues with language. That's not something that I can control. This is who goes into the job of home health care. These are people that, unfortunately, most of the times are coming from other countries. These are immigrants coming, and this is one of the first jobs that they have. So when they come to our orientation, we do orientation every Thursday. And one of the things that we notice is their language is not perfect, and communication is definitely an issue. So we're going to be starting in January English as a second language offered in our company. It's something that we're we're partnering with BOCES to create a curriculum specific to home health care, because it is definitely an issue. I'm the nurse here. I'm the one that they talk to all the time. I'm the one that they hang up because they can't communicate with me. That's an issue from the nursing perspective, because I have to make sure that they understand what's going on in the home and the patient is safe. We are not different than any other company. We all pull from the same home health aid. So it's not like you're going to go to agency A, B, or C and get someone that's going to speak perfect English. That's not the situation. But we are trying to change that. So offering this is going to be mandatory for the employees that don't have conversation skills, that can at least communicate with me, because I'm the only person, well, except for Danielle, we're not bilingual. So I can't speak Creole, I can't speak Spanish, although everybody else in the office does speak another language. Me as the nurse, I do not. So it's something that you're gonna come into contact with. Their language skills are definitely something that needs to be worked on. So is that something that you guys are experiencing right now? Can we say who your mom is? Who is your mom?
Yep.
Okay. Who is it?
I don't know.
Oh.
I don't know who's your mom.
Eileen Thornton.
Oh, okay. So
And it's Rosa, and Rosa
Yeah,
is
she's great.
fabulous.
Yeah.
We love
No,
her.
we
She
know.
comes in,
It was, you know, she could come
she's
around.
fabulous, and while there's no problem, they use sign language or whatever, but our concern was that if there should become an issue where she needs to communicate, she can't, and none of us speak Spanish.
Yeah, but
so-
what they're told to do, just so you know, is to call here. And somebody here is going to be able to communicate. Julia's bilingual, Mildred's bilingual, Linda's bilingual. I am not. So, but they will definitely come to me and say, hey, Dana, the aid's on the phone and this is what's going on, and we'll direct the aid. Is it the ideal situation? It is not. The language is definitely something that, you know, is an issue, but it's a universal issue in the industry. So the best thing that we could do to, you know, correct that is really to offer English. A lot of them do go to school for English, so you'll find that they do speak some level of English, but they're afraid to use it. I don't understand why. You know, they'll sit here and I'll hear them talk English, and then I'll walk in and all of a sudden they don't speak English.
Because they're uncomfortable.
I know,
Yeah.
but
If you feel like they're not gonna understand what you're
Yeah.
saying,
They
you
can be
become
embarrassed.
uncomfortable.
The translation, or maybe even the tense in which you. But you know how I come across to that is that the family members really don't care. They just want to know that you try.
Right.
And if you're trying anything with a smile, and I'm happy to hear that she's providing your mom with quality care, and she's very
She's
good
great.
to
Yeah,
her.
you should
So
Absolutely.
that
She
that
does a great job.
at the end of the day, that's what we want, right? So we're gonna work on getting her skill level, so that way there could be some conversation, because it's important.
If they call here, if you call here, that's the one thing I don't understand. Like they sometimes they think that we're not here, but we're not here, but we're always on the phones. I'm the on-call nurse. All the staff rotates on-call. So even though, like, if they get me on the phone and they hang up on me, I'll see the name. I'll be like, Julia, call it back and find out what's going on. So we're very much on top of, you know, this is 24/7. It's our lives.
I'm sure,
Yeah.
yeah.
So it becomes something that, you know, my husband hates it, but you know, it's the reality of home care. It's not going away.
We were even thinking about looking like for an app on the phone or something that we could use for
There's a
translation.
translating app, yeah.
And work with that on it. My mother would not be able to do that, but one of us could go over.
So
with
let me
that
ask you a
and work
question,
with
because
that.
you're saying something interesting to me. So, because one of the biggest complaints that we have a few complaints, and once again, it's a universal complaint. This is not Reliance based. It's industry wide. So we'll get families that call up, they don't speak English, blah blah. So what is it that allowed you to keep her, even though the communication? Because most people would have called us up and said, get her out of the house. She cannot communicate with my mother. This is not working. But when you do allow someone, that's the part that we try to tell people, is that I'll give them time, you know, because there's other ways to communicate. It's not the best idea, and it's definitely not for companionship. But if they're, you know, most people would be calling complaining.
We did not, because Rosa came in, she was like a ball of fire. She hit the ground running. She was cleaning floors, doing things. She was so positive. She was giving my mom hugs, and my mother is not an easy person to love. But she was giving her hugs. She was just a wonderful human being where you wanted to work with her. You wanted to overcome this problem. The other thing I will say is the fact that my mother is not sickly, where we were concerned that she wouldn't be able to communicate her needs, and that was another
But over
issue
time, if
with
she
it.
becomes where she's gonna,
Then it would become
Yes.
more of a concern.
okay, so someone like her, when we, they do offer, BOCES offers locations of English as a second language, but they have to pay for it. So we decided here that we are gonna offer it for free. It will, like I said, it's gonna be mandatory for certain home health aides that really can't communicate. It's gonna be, part of their employment here. So she's probably one of the ones that we would encourage to come. But it's something that all the home health aides are gonna have to, consider if they're gonna remain working with us. Because that is really the number one complaint that we get from families.
Actually, my mother's learning Spanish.
Oh, see? That's smart.
My mother-in-law is teaching the aide.
I love
She
that.
has one that's Venezuelan. She said she
She loves
speaks
them.
English. She's accented. She speaks English, but sometimes she has a hard time communicating. So my mother's like, so I'm teaching her English, and she's so proud of herself. And this is a woman who the first day.
Yeah,
she
you
started
wrote us
November
hard.
1st.
Yeah.
November 1st, she had a different aide come. She was there
That's
an
the
hour
feeling
or
that we have a
so.
problem
There
with.
was a
Yeah.
inability to communicate whatsoever. She told the aide to leave and called here. And
She
now
asked
she
for
has,
water and she brought us Swift.
I remember that.
Yes,
From
I
yes,
remember.
yeah.
every
But
year-
that's an extreme case of
we started off at a very rocky start.
yes.
My mother had been with another agency on private pay when she had come out of the hospital. First it was Medicare, then we were paying until everything got set up for this, and the transition was horrible. Horrible. I'm not gonna lie. And now I'm like, this is the best I've seen her in.
But let me ask you a question. So, what made you stay with us? You could have left. People jump
Okay,
agents.
I'll tell you
wait,
what-
you gotta remember, I told you, I have an early intervention agency. I deal with this all the time. And I have people who call me about my therapists. Now, they have to speak English, obviously. It's a little different situation. But I will say to a parent, I can make changes, I can do. So I'm doing it. It's funny, she laughs. I call it's EI, early intervention. She calls this EI, elderly intervention.
Oh, that's true.
Okay, so you've got a new term. So it's very funny because I have dealt with this. So it's like, all right, let's get somebody else. Let's try this, and and my mother-in-law loves me. I'm the only one that ever dated her, was with her, that my mother-in-law loves. She will listen to me. So I will go in and say, let's try this, Mom, and it will work out.
What kind of information or
It's
help
a
could you?
couple of things, I think. Can I say
Sure.
something? Thank you. I think there's a few things. First of all, it was figuring out what she expected and what she's entitled to. Because it was on both sides. There were issues. There was no question about that. Also, it was setting up some sort of a schedule. Like I said, when the aide comes, why don't you have her take you downstairs and go out for a walk? And then when you come back in, because she likes to shower downstairs, shower. Then you come up and you can do this, that, or the other thing. I told her also, give them a chance. When we started with the other agency, there was one aide she hated. She told them, don't send them back, don't send her back. They said, listen, we don't have anyone, I think it was a Tuesday, Thursday. We don't have anyone on Thursday. Can she come this one time? At the end, my mother loved her. Part of it is you have to give it a chance for the two people to get to know each other.
So you're new to home care. Okay, so let's say that there's a situation where the person is not speaking the language that you guys need and cannot communicate. What we find is that families will just say, you know what, it's the same, I'm going to go someplace else or whatever. They don't understand that when a home health aide or a person, and actually we have the home health aide job description so people understand what it is. When an aide is coming to the home, it's like a blind date. They don't know you, you don't know them, they don't know your house, they don't know the kitchen, they don't know the bathroom, they don't know the setup. But yet, a lot of times the families expect the aides to come in and say, take over, there, yeah, let me take that pot, let me get it. That's not the way that it works. We need the families to partner with us to make sure that in order to have a good interaction and relationship, the families have to give a little bit. You can't just expect the aides to come in and take over and be their care provider. They need direction. And we find that the families think the direction should come from me or from us, a social worker, whomever, when we provide our part of the direction, but I don't know the house, I don't know the bathroom, I don't know the routine, I don't know where their cups are. We actually have had families call us and say, get the aide out, she doesn't know where my mother's dishwasher is or how to put dishes in it. So it's like, well, show them one time, give them that respect, and move forward. And so that's the difference.
That's one of the
I had
things.
that argument with my mother,
Yeah.
time and time again at the beginning. She said, the aide was there. She didn't even offer me a glass of water. I said, did you ask her for one? No. I said, she's
It's
not
very
a mind
common.
reader. She's not a mind reader.
And the other thing, my mom,
Once she's there for
Yeah.
a little while and she knows you like water, you like apple juice, you
Yeah.
like this, you like that. I said, you have to tell her what you like.
You like chicken parmesan?
yeah, but she makes it.
No, that's an inside joke.
Joke, huh?
I said, train her. Okay, that was it. You know, she has the Purdue cutlets. You know, she says, I can't understand how she couldn't know how to make it. I said, excuse me. I said, suppose she's from India. I said, and she could make you a gourmet Indian meal with saffron and curry, you know, and all that. Would you like it? No answer. I said, no, you wouldn't eat it. I said, now, let's flip it. You're going into her house. Can you cook the way she likes?
This is exactly what people need to know and to hear, because the expectation is one thing, and then when the aides get there, they have to realize it's a different culture, it's a different mindset. When they go to the door, I always say, you know, when they go to the door and they knock on the door, they don't even know what to say. So if the family's not welcoming them and giving them the respect of saying, come in, you know, this is where it goes, this is what we do, it's starting off on the wrong foot right then and there. You know, we send a registered nurse within 24 to 48 hours to set up the care plan for the aide. You know, the care plan is minimal. It's really what we're saying to the aide: bathe them twice a week. They need dentures. This is how they transfer. But it's not going into the family. You know, it's not going into the household. And really, like most of the complaints that we get is based on what you're saying. You know, food preparation, not knowing how to fold clothes, not knowing how to mop the floors the right way. Those are all secondary things. If you guys look at, you know, what a home health aide job description, well, you probably already know this, but I'll give it to you anyway. You know, what a home health aide job description is, you know, it goes into, they go to school to be caretakers. You know, there's got to be some level of care involved as well. You know, they're not Mary Maids. They're not there to just be the domestic person. They're there as that's part of it. But the bulk of what they're supposed to do is caring for the person, bathing, dressing, toiling, diapering, whatever that may entail for your loved one. And all that other stuff is secondary to the physical care that they go to school to learn.
See, what I had to explain to my mother-in-law, because it was new to her. You know, she shakes, but her mind is, I mean, you know, she's, you know, and so I had to explain to her, I said, Mom, you have to understand something, which we both did. You know, first of all, she has the 5 hours. She cannot comprehend that the woman, she can't find 5 hours worth of work for her. Well, because she's going to cook, she's going to help you bathe, she's going to take you for a walk. If you have nothing for her to do for an hour, she's going to let her read something. You know, she's there to help you when you need the help. And so my mother-in-law first had to get past that they're not going to be running around like an office like you do probably all day long. Mm-hmm. The other thing was, as my wife says, Gloria said, we also had to explain to my mother-in-law, you show them how.
Train them.
Yeah.
We have the
Train them.
food there. You like the little potatoes cooked this way? We get you all the makings for it. Explain to them, cut it this way. Get the you know, the spices, whatever you like. They'll put it in the oven and everything, and we, you know, because my mother would sit there and go, well, they don't know how to, because yes, we made it very simple. Well, they don't know how to make that steak I like. Well, tell them how you like it. Tell them what you want.
But those things can help build communication, and at the same time, it's helping your mom stay active and talking and remembering her recipes. And
Right.
this is how they can bond
And
together.
that was just it.
Well,
I
the
said,
other day
cook together.
The other day they were doing a crossword puzzle together. I thought that was great.
Right, and they got her jigsaw puzzles. There's one that I got, apparently it's very hard. We've been working on it for days. I'm like, yes! That's what I want. Because also my mother's starting to lose her memory. Her short term is,
Yeah,
she's still, you know.
she has good days and bad days.
Yeah. And I said, you know something? Crossword puzzles. I got the large print. You know, figure that it'll be a little bit easier. Jigsaw puzzles, my mother always said she loves them. I said, they're also good bonding time. And she doesn't realize I'm doing it for her mental acumen. I'm not going to sit there with her and do a puzzle. I can't sit there, you know, for hours and do it. But, you know, if she does it even for a half hour or something, they bond, and she's getting something that'll help her mentally. Like, once we start putting those things in to place, she's doing better now than she was when she first came out of the hospital.
Success! Yay! So I'm just curious, who's your family member?
No, my family member is Matthew Shelfo.
Oh, you're the
And
sister.
I wanna no, he's my dad.
Oh,
Everyone
oh,
thinks
oh,
I'm
okay.
his sister. He's 92 years old. So
Oh, okay, wow.
I'm good if I'm his sister. But I just want to thank you guys because I freaked out on the first day. Bethone
Mm-hmm.
came, and she must be very new. And I'm an ESL teacher, so I know what it's like for people who don't speak the language. But because
may hire
it
you.
was so,
Yeah.
you could. I'm retiring next year, so maybe I'll come by. Because it's so personal, I just freaked out because I couldn't communicate with her. She's Haitian Creole. She speaks Haitian Creole. So, but when I called you guys, you understood. And Yaritza
Yadi, yeah.
came right away to the house. And I said, I really just need someone who can just communicate a little more. And you sent Eloise. I call her Eloise. I don't know if that's her name, but she seems to be fine with that. I know she doesn't understand everything, but she understands more. But Bethone comes now on Sundays, and I'm really fine with it now. And I think my dad is too, you know, so that's a little different. You were able to kind of understand how I felt.
I've been a registered nurse almost 30 years, and in home care most of my career. And it's funny because it's the same problems all the time. So that's why we started creating these different concepts and ideas and things to put together, because it's not getting better, it's actually getting worse. And so one of the things that you'll find with our company, I hope, is that we recognize the issues, we try our best to change it, and we're actually implementing steps in order to make it better. One of the things that you're talking about with Yadi is that she's our home health aide supervisor. So what we're doing now, and once again, we're not immune, this is industry-wide, we will have in-service and orientation. We in-service everybody every 6 months, probably similar to you guys. So they all come in, and I'm talking to them, and we're doing orientation, which is for new hires. And if they've never touched a human being before, they're not touching one of our patients. But a lot of times what happens is they need the opportunity. So we started a preceptorship program for home health aides that, you know, if I said no to people that just graduate, we would have no employees. You know, so you have to give people an opportunity. So what we're starting is with Yadi being one of the best aides that we have. We moved her into a supervisory role, so where if there's a person that's coming to start to work for us and they've never done this job before, or maybe they took care of their mother but they never took care of a patient, Yadi will go with them for the first couple of days and make sure that they understand, you know, how to knock on the door, how to say good. What? Yeah, they're shadowing them, which is where I would tell you should look around, and I bet you we're the only agency that does that, because it really does bother us when we get those phone calls, and we're all sitting here going, how do we fix this? One of the other ways to fix it is to invite families in, have these conversations, put it on our podcast so that other families see, you know, oh, I should get angry, but call the agency and don't just, you know, kick the aide out. Give people the opportunities to fix the problems, because all the problems are fixable. What we would find is that families would be so angry, so violently angry at the thinking it's us, and at the end, you know, we're trying to calm them down. Julia is probably the best diffuser of issues that we have, but still some families don't care, and they'll jump to another agency without even giving us the opportunity to fix it, and they'll find it's the same thing, you know, then they'll come back. So that's really why we put together this program, and we have the podcast. I encourage you guys I'm actually going to invite you on to the podcast, because what families really need to know is you're not alone. It's a very scary thing to entrust your loved one with someone who you feel can't communicate and can't effectively take care of them. And we don't want that. I don't want that. That's not what we went into business for. We went into business to help people. So that's why we created our team, although Danielle is, she's our customer service person too. So if you want to yell at her. She's a very good diffuser too. Mildred will go out there and see the family. So if there's a problem that's going on and a family's got concerns and the families are saying, whatever the case may be, Mildred will go out and help too as a community person. The other thing that we started is a case management program here, which is where Linda comes in as a social worker. So we'll find that there's families that have behavioral problems. This doesn't apply to you guys, but you know that there's behavioral problems, there's dementia, there's issues going on galore. You know, it's not where they jump from company to company, not because the company is doing anything wrong. It's the patient, you know, sometimes they have problems. We also are looking to put physical therapy in for all of our patients, because we don't want them to be rehospitalized. We want them to stay home. So we're trying to decrease the rehospitalization rates for families and for the hospitals around, which is where Linda comes in as well. You know, we really will encourage people to have physical therapy. It doesn't cost you anything. It will help with the, you know, the mobility, keep them active, keep them mobile. And we will do the nursing as well for some families that are having some medication issues or some questions about medications, or my dad's on 20 and maybe only really needs 3. Are they over medicated? So we'll happily send a registered nurse to the house to go over the medications, because that's one of the reasons why people are rehospitalized too, is not taking their medicines right. I go out as the nurse sometimes to do the start of care, and when people don't want me going, because when I go, I find problems every time. So, we'll have families that don't understand, if you, once again, I don't think it applies here, but if your loved one is on insulin, an aide is limited in what they can do. These people go to school for 3 weeks. I'm not saying that that's a lot of time or a little bit of time, but that's the way that it is. So you should not be entrusting home health aides on any level to be medicating your families, giving insulin, doing things that they're not appropriate to do. That's what we give out the job description. It tells you, very clearly, no insulin, no feeding tubes, no colostomy care, nothing like that. That's a nursing issue. But I do find a lot that the families expect the aides to give the insulin and do this and that. That is not what they do. They're not supposed to, and they will be reprimanded if they start giving medicines above the level of what they're supposed to. But if there's a concern, if they're saying, hey, dad, mom's got a safety problem, I think that their gate is off, Linda will happily go, we'll make a referral to our home care company. Like I said, it doesn't cost your families anything. It's something that is part of their benefits, not through Medicaid, but through their Medicare. And we can make those referrals at any time. So I would encourage you, if there's any type of issues going, even a safety issue in the home, say, oh, you know what, I don't know the bathroom, maybe I need grab bars, can someone come and assess that for me? Happily do it, because we want you to stay home. Hi there, it's me again, Dana Arnone from All Things Home Care. Just wanted to remind everybody to find us on Facebook, iTunes, or Google Play. Follow our podcast, let me know what you think. If you have any suggestions of information that maybe you'd like to hear, or it's something that you can have some help with, or some guest that you might like to see on the podcast, or maybe you yourself want to be on our podcast, we'd love to have you. So give us a call here, 516-308-4840. Visit us on our website, reliancehssny.com. You can talk to me through the website. Please let us know what you're thinking.